My name's Duncan Mcdonald. I'm a physical therapist and the owner of Texas Orthopedic Specialists in El Paso, Texas. The goal of physical therapy for back and neck pain should be to treat the cause of the symptoms. The symptom is going to typically be pain, and the cause of that symptom will normally be the inflammation or pressure or both. And the physical therapy treatment should be designed to reduce inflammation and address the pressure that's causing the pain, thereby taking away the pain and the cause of it. This Physical Therapy Practice Act changed last year in Texas, and it is possible to see a physical therapist directly without a doctor's referral for a period of 10 days. Having said that, it will only be useful to you if you're a patient who doesn't have insurance or paying out of pocket, because an insurance carrier will still not pay for physical therapy without a doctor's order. A first visit to physical therapy won't be very different from the doctor's visit. You'll be asked a series of questions to try and determine the history of the condition and your symptoms, and then there'll be a full physical examination of your condition. That may involve performing range of motion, may perform repeated range of motion testing, strength testing, a neurological examination, and some palpation. At the end of that examination, your physical therapist will determine the treatment approach that should be the most suitable for addressing the cause of the symptoms and the problem that you are having, and that will be discussed and typically implemented during the first visit. Initial visit will typically take 1 hour to 1 hour and 15 minutes, including the standard paperwork that has to be completed prior to starting a physical therapy examination. I think the questions you should ask your physical therapist are any that come to mind at any time. You shouldn't be hesitant to ask any question of your physical therapist, assuming that it's relevant to your condition and physical therapy. I think fair questions to ask are, how likely is it that, in the opinion of the therapist, that physical therapy will help your condition? I think a fair question is, how long will it take before I will feel some improvement? I think the key question to always ask your physical therapist is, how is the treatment that you're giving me today going to address the cause of my symptoms, thereby treating my underlying problem and not just the symptom itself? Whether or not physical therapy will help a patient avoid surgery will depend on the nature of the underlying condition. Some conditions will need surgery, and physical therapy will be of no benefit whatsoever. Other conditions, on the other hand, respond very well to physical therapy, and surgery can be avoided. In either case, if it is possible to undergo physical therapy at any time, it should always be done prior to undergoing surgery, so that in hindsight, a patient will never look back and wonder whether or not they needed to have surgery. They should go into surgery knowing they have tried to do everything that is possible to avoid the surgery, and that physical therapy was not going to be of benefit. At Texas Orthopedic Therapy, we do specialize in orthopedic physical therapy. This will involve treating all parts of the human body: cervical spine, thoracic spine, lumbar spine, shoulders, elbows, wrists, hands, and of course working down hips, knees, feet and ankles. We will see patients preoperatively to try and help them rehabilitate after accident or injury, and we will help them with neurological problems, and we will also help to rehabilitate people if they have had surgery to regain the normal range of motion, strength and functional ability.